Hi, it's Dr. Robert Brueck coming to you again with another segment, What's New in Cosmetic Surgery. We're going to talk about several ideas, some new technology, some new thoughts. Also, what I'm going to do is start asking a series of questions. These are questions patients ask me all the time on a routine basis regarding certain cosmetic procedures. So I'm going to ask the question and then give you my answer and response and sprinkle in with it my 37 years of experience. Again, if you have issues or questions that you would like me to address or comments about some new technology or something you've heard, feel free to contact me. You can go to my website, Beauty by Brueck, and request a consultation or email me. My email address is rjbrueck, B-R-U-E-C-K, @abodyandface.com. So we look forward to your comments, your suggestions, your ideas, as we try to educate you about some of the nuances in cosmetic surgery. First thing I want to talk about today is tattoos. I think all of us will agree that tattoos are everywhere. I always comment one time that I think in order to live in the city limits of Denver, you have to have a tattoo. So certainly they're very, very popular. And many times individuals have a tattoo, they have regrets about it, and they wish they could do something about it. And usually it involves expensive lasering techniques, and the results are always a little bit less than ideal. Well, there's some researchers now. The guy's name is Alec Falkenheim. He's in Halifax, Nova Scotia, is working on a cream that will go ahead and do away with the tattoos. What happens when a person gets a tattoo? The pigment is deposited into the dermis of the skin. And there are cells called macrophages. And what these macrophages do is they're attracted to the pigment. They engulf the pigment and they sit there and lie dormant. And hence you have the tattoo, which over time will fade and go away. And so what this cream does is this cream actually is placed on the skin, and what it does is it kills the macrophages so they can't attack the pigment and help the pigment stay. So now the pigment can help be eliminated. Now, whether or not this will be a definitive treatment, more research is being done, but it's very, very promising. And how great would that be? You get a tattoo today, 2 weeks later, you regret it. You go to your local pharmacy, it'll be a prescription drug, and you'll be able to get this cream, put it on your tattoo, and voila, it's gone. So, food for thought, something new on the horizon. The second thing that I want to talk about is second skin. You know, many times patients ask me, what can I do to my face to make it look better, to make it look younger? One of the researchers, or a team of researchers at MIT, has come up with a thing called second skin. You know, it's sort of like the blackout shades that we have on our cars. We put a thin film, polymer if you will, on the inside to block out the sunlight. Well, this is a dual cream that people can put on their skin, and you put it on in the morning and you take it off in the evening, and it will cover all of those unsightly wrinkles. It can be used, for example, if you have blemishes like brown spots, sun damage, port wine stain, things of that. And then you can go throughout the day, do your normal activities, swim, do everything, work, and then in the evening you take it off. Like I said, it's a series of creams. There are 2 creams. And the second one is a catalyst that creates this polymer film of new skin to cover up the old unwanted skin. So second skin, whether or not it will have clinical applications, remains to be seen. But again, it's something on the horizon, and if we hear more about it, we'll certainly let you know. The other thing that I want to talk to you about today, and again, a lot of people ask me about some of these new non-surgical procedures. What made me think about it was I saw a couple people that came in to see me this week that had some facial cosmetic surgery done. In one case, one person had it done twice and was very unhappy with her neck. There's a new product by Cabela called Kythera. I don't know if it's Kythera, Kybella, Kythera, but it's a liquid that you inject into the fat of the neck area or the face to melt the fat. I think I did this years and years ago with a product called deoxycholic, which is a naturally occurring substance. And for sure it will melt the fat. But I think people need to understand that when you melt the fat, you may expose an aspect of aging that you don't like. And one of the reasons I think necks are so popular now, and they're very difficult to do and to do well, is the fact that many people have pictures taken on Facebook or Instagram or whatever, and they look at their profile and they say, oh my gosh, is that me? So social media has caused an increase. So a lot of people want to get something that's non-surgical, that's easy. First of all, many of these treatments are very expensive. And you go ahead, for example, you inject and melt the fat. It's very difficult to control with any kind of precision exactly how much fat you're going to remove. You remove the fat now that was blocking or covering the bands in your neck. So now you've got less volume, but you've got these unsightly, old-looking neck bands. And again, this week I saw a couple people that had facelifts done, and one had a neck lift done, had it redone, and it just wasn't satisfying to the patient. They didn't look good. I had another lady that spent $5,000 on fillers to her face, and they said that these are going to last a much longer period of time. And I think at the end of the day, I would rather use your own tissue, i.e. your own fat. If I can rebuild your face with your own fat, why wouldn't I want to do it? Because one of the aspects of aging is loss of volume. And that brings me to another thing, and I see this advertised all the time. Everybody's talking about the liquid facelift, the vampire facelift, all these different terminologies, if you will, to describe a unique form of facelifting. The liquid facelift is nothing more than putting in a bunch of fillers and maybe some Botox, and I guess it's okay if that's what you want. But unfortunately in my practice, because I do a lot of facial cosmetic surgery, I see people that have had liquid facelifts where they've had all these fillers put into their face, and then 4 months later, 6 months later, it goes away. They spend thousands and thousands and thousands of dollars. And at the end of the period of time, 6 months to a year, they're left holding the bag, unhappy, dissatisfied, and still looking 65, 70 years of age. And that's one advantage of going to a board-certified plastic surgeon, is that I can give you choices. Those choices from A to Z, from the least invasive to the most invasive. So on the outside, it may seem nice, like incisionless breast augmentation. I'll do a breast aug, there'll be no cutting. Ideally, it sounds great. Practically, it doesn't exist. So I think you as a consumer, you need to be extremely cautious and wise as to what's going on and how it's being done. Last thing I want to talk about a little bit today is cosmetic surgery. It's a huge industry. In fact, in 2015, $13.5 billion was spent on cosmetic procedures. Now, the vast majority of that was on non-surgical procedures. Fillers and Botox lead the way. 11.5 million women had cosmetic procedures performed in 2015. This is an increase of like 560–70% over the 1997 statistic. And 1.5 million men had cosmetic surgery of some form or another. Again, it could be fillers, could be a neck lift, facelift, liposuction is very common in men, gynecomastia is very common in men. The number one procedure, liposuction, followed by augmentations, tummy tucks, facelifts were number 5, and for the first time, cracking the top 10, fat grafting to the face. And I really think fat grafting is going to be the thing of the future. I would say 60% of the time when I do facelifts, I will go ahead and do fat grafting in order to restore areas of the face that have lost volume as a result of aging. Another area where fat grafting is becoming extremely popular has to do with breast reconstruction, whether it's primary augmentation, where we add patients' fat to an area of the breast where they've lost fat, to breast reconstruction where women have lost soft tissue as a result of a mastectomy or something of that sort. It really is a nice adjunct. In fact, on Friday, I did a breast augmentation and I utilized patient's own fat from her thighs to go ahead and rebuild the superior part of her breast where she lost a lot of volume. And I say to people, it's like a two for one. You get an area of liposuction where you want fat taken away, and rather than just throw the fat away, we put it into an area where you want it. So fat grafting is becoming more and more important. It's a great tool that we can utilize for reconstruction of different parts of the body that have been lost as a result of malignancy, injections, or cosmetically to restore part of the soft tissue that was resulting loss of, for example, in pregnancy, when women's breasts will become smaller and they lose volume. So yeah, it's an important part of the armamentarium, and I think you're going to see more and more utilization of fat in various aspects of cosmetic surgery. So again, I want to say thank you for listening to us. We're going to go ahead and start answering some questions concerning popular questions people ask me over and over and over again. But again, if you want to contact me, you can go to my website, Beauty by Brueck, or email me at rjbrueck@abodyandface.com. My telephone number is 239-244-2329. I have offices in Fort Myers, Cape Coral, and Punta Gorda. The consultations are free, so why not come in, maybe give you a second opinion, maybe do a primary consultation to address the areas of concern for your body. Again, I want to say thank you and want to wish all of you the best of everything. God bless and have a great week.